In December 2019, the novel coronavirus Covid-19 emerged, triggering a global health crisis. The ensuing journey was marked by unprecedented challenges, resilience, and human determination. As the virus spread globally, nations responded with border closures, lockdowns, and strained healthcare systems. Amid the chaos, stories of courage emerged. Communities adapted with innovative ways to connect. Remote work transformed industries, and masks became a symbol of unity. Despite the hardships, humanity survived, learning to coexist with the infection and establishing new norms for living in a pandemic-altered world. Kenya reported its initial COVID-19 case on March the 14th, 2020.
I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya.
With a population exceeding 50 million, the country geared up for the pandemic's impact, mobilizing resources to curb the spread of the virus. Measures included creating quarantine facilities and enhancing testing capacity to mitigate the effects of COVID-19. Scientists and researchers strived to comprehend the virus and create vaccines in a race against time. Innovations in vaccination technology gave hope for the COVID-19 pandemic and signaled a major shift in the fight against it.
COVID was a challenging viral infection. People didn't know much about it. But thanks to technology, collaborative partnerships, the cause was established. And not just established, but a vaccine was developed.
In order to raise awareness of the COVID-19 immunization, USAID collaborated with the University of Nairobi, Kajiado County and Nairobi County together under the Fahari Jamii program, which stands for Pride in Our Communities.
The COVID pandemic was such a big problem. The US government provided additional funds to the Kenya government through the existing HIV service delivery mechanisms, including primary healthcare integration. And at the initial part of the response, we were required to work with the county governments of Nairobi and Kajiado to increase uptake of COVID-19 vaccination in the two counties.
Employing targeted outreach and culturally sensitive messaging, the campaign gave people the power to decide for themselves whether or not to obtain the vaccine.
Part of the reality of the population that we serve is that you can segment them into maybe 4 sections. Those who are very willing to be served, those who were willing to be served but had questions in mind, those who were resistant but could be persuaded, and those who are very resistant. So at the onset of the pandemic, one of the initiatives that was introduced was the vaccination, which would then help the humanity to be able to prevent the condition. Unfortunately, at some point when you're successful, you've taken care of those who are willing to be vaccinated. We transitioned to those who were asking questions before they gave us the go-ahead to vaccinate them, and reached the group that needed to be persuaded further. And that needed extra manpower.
Kenya started a nationwide vaccination initiative with priority being given to the vulnerable groups, the elderly, and the frontline workers.
In March of 2021, Kenya started vaccinating its population against COVID-19 disease. And at the height of COVID-19, everyone who was eligible was advised to go and take the vaccine at their nearest facilities. Due to the numbers of people who are heading to these facilities, the county was a bit overwhelmed in terms of human resource and other supplies. So we came in to support them to fill in on the gap that they had communicated.
The program aided the two counties by implementing outreach initiatives at diverse institutions and health facilities through supply of mobile phones and airtime, along with branded aprons, t-shirts and megaphones used for mobilization.
It is Fahari Jamii which has purchased the gadget, and also they equip us with airtime to register the patients in the system, and for the patients to be able to have their COVID vaccination certificates.
Nikienda huko nje kutembea, naweza kuwa na megaphone ile natangaza, naweza kuwa na poster na nafundisha hao, hata naonyesha hao vile iko. Wale tumekubalia nao, mimi natuma hospitali wanakuja kupata chanjo.
Conducting healthcare worker training targeted for COVID-19 mobilization, vaccine uptake, and overcoming hesitancy, ultimately aiming to enhance health outcomes.
Fahari Jamii supported us in the initial training. Then later on, during the cascade training, they are still the ones who came in handy to support us to ensure that the training is cascaded to the sub-county level and also to the facility level.
Fahari Jamii came in to work with us in creating awareness for COVID. This was one of the major projects that we have done with them in regards to COVID-19, creating awareness, increase the uptake of vaccination within the community.
Initially, we started with capacity building, where a total of about 66 healthcare workers and in both private and public facilities in Kajiado West were trained on COVID vaccination, the update, and they were also trained on the documentation for COVID vaccination.
Election ya corona nalo hospitali na udi na don maanenye na ya ina ujumbe community nenyo rasi ninje nipono metudi ni dolajo meara madhara yoyote to sisini.
Developing a DHIS2 system, which was a data system for data monitoring aggregation.
Our data capture reporting and the reporting tools, we did it with, for the electronic ones, it was M-Chanjo for registration and administration of the vaccines. And then we had the DHIS, that is District Health Information System. It captures the data on daily basis. For the manual capture, we did it with daily tally sheets and registers.
USAID Fahari Jamii in data management and monitoring and evaluation employed data clerks. They designed the registers, we came up with the tally sheets, and also designed a DHIS2 platform that was used to collect the information that was needed for COVID-19 vaccination.
Assisting in procurement of supplies for vaccination such as vaccine carriers, fridge temperature monitoring devices, sanitizers, color-coded bins, and bin liners. Supporting transport logistics for vaccinating teams into mobile outreach centers and for vaccine pickups and distributions.
Our regional store is based in Kenyatta, so we pick via cold boxes from the regional stores. Then after we've received them, I have 34 immunizing facilities that receive vaccines from here. So through Fahari Jamii, they've really assisted us in getting the vaccines all along, because we had a challenge of transport, picking the vaccines and taking it to the last mile.
This being a very difficult and hard terrain, the project came in handy in terms of providing support through vaccine distribution in the hard-to-reach areas and also in the facilities around Kajiado West.
Through the support of USAID Fahari Jamii, we are able to reach those people in this community in the hard-to-reach area. They support us to facilitate on transport, also to facilitate for the CHVs, and also to facilitate us to collect vaccine from the farthest place, which is Oltinga, which is the central plain.
Coordinating weekly virtual data review meetings to enhance outreach planning.
I really loved the bi-weekly data review meetings, because with those bi-weekly data reviews, we were able to tell where we are, and we also used to chart the way forward on how best we can be able to reach dropouts and the unreached.
Supporting quarterly sub-county and county data review meetings for precision programming.
USAID Fahari Jamii has been very instrumental. We know that for demand creation, they were able to support health workers looking at the community health strategy focal persons in the 17 sub-counties, and even organizing for us stakeholders meeting.
Supporting supervisions to assess the implementation of COVID-19 vaccination activities.
We've also had some joint supervision together with them, going to facilities, checking the records, checking the vaccines, the storage, and also how they capture the data.
Additionally, Pre-mobilization activities across sub-counties were conducted to identify unvaccinated populations with unmet needs and provided COVID-19 vaccination services through targeted integrated outreaches.
We first had a sensitization or kind of training on what is COVID-19, and through their support we managed to reach 730 community health volunteers.
In Kajiado West, we have what is called a differentiated service delivery model, whereby if the clients cannot come to us, we look for a way where we can get to them. And that is where the outreaches have really helped. So when we have outreaches, they are normally in the hard to reach areas. So we carry whatever we require and we go to a place that is near the villages, near the bomas, where now the clients can come out and have the services offered to them.
Before, watu hawakuwa wanaweza kufika facility sababu ya umbali ama distance. Kushirikiana na Fahari wa jamii na county, tumewafikia nyumbani, watu waliweza kupata chanjo.
It also supported expanded immunization program, EPI COVID-19 data reviews in 10 sub-counties, monthly EPI integrated support supervisions, and county EPI COVID-19 data review. To have widespread vaccine distribution, the program executed impactful strategies. Capacity building through training on infection control and vaccine administration. Correct, timely and complete data collection for essential information to guide decision-making. Support high-volume and medium-level facilities in reach, as well as experienced teams for vaccination services execution. Advocacy and risk communication support to curb mis- and disinformation about COVID-19 vaccination. Targeted community mobilization activities including group leaders, religious leaders, physically challenged, social groups, and representative community groups. Increase vaccine access and adoption by delivering vaccines directly not only in public facilities but also increase capacity of the private facilities to offer vaccination services.
We were able also to integrate the COVID vaccine into other facilities, because when it started we had picked our public facilities that were doing the COVID vaccination. But through Fahari Jamii project, we were able to integrate to ensure that the vaccines reach to the last facility.
The program facilitated COVID-19 vaccination status screening through community health promoters, CHPs, and advocates, CHAs.
We have an outreach which we have organized. We have a team which is going to the community to vaccinate our clients. And these clients, we have mobilized them through the community unit. In the team, we have a data person, this data clerk, and she's going to record all the clients who have been vaccinated. We also have our COVID-19 nurse who was privileged to be trained, and he is going to make sure that all clients who have been registered and entered in the mchanjo are also vaccinated. So we've also talked to the chief, who was very handy and has given us security for the team to go and vaccinate.
Tumeweza kujaribu kuweka utulivu na pia kuweza kuhamasisha jamii yetu hapa umuhimu wa chanjo na pia kuelezea pia madhara ya kukosa kuchanjwa.
Utilizing community desks, service providers screened and recommended vaccinations, employing home visits and referrals to expedite uptake and raise awareness about COVID-19 vaccination.
We are ensuring we are able to integrate this kind of vaccination and demand creation within these outreaches. And so far, I would say in Shompole, for the first outreach, we were able to reach 13 clients with the service. And then for Kajiado West, so far we've been able to reach 417 clients. So we have a plan to continue implementing this important service, both at the community and at the facility.
Some of the achievements of the programs include: Nairobi County excelled, fully vaccinating 59.1% of adults by January 2024. Additionally, 8% of the school-going children aged between 12 to 17 years were vaccinated.
Through this support, we are the leading county in terms of scale-up of vaccination. We actually
the leading county with about 59% of our adult population fully vaccinated against COVID.
Kajiado County achieved 44.1% adult vaccination and 16% for 12 to 17-year-olds by January 2024, showcasing notable progress. Nairobi's FYJ-supported CCCs reached 62% PLHIV vaccination coverage, up from 38% in 2022, and Kajiado improved from 49% to 72%.
We also targeted the CCC as well, so that we have people who are living with HIV, people who are living with NCDs, to be vaccinated against COVID.
COVID-19 vaccine integrated into healthcare at 92% in Nairobi and 78% in Kajiado since April 2023.
COVID is the first vaccine that every adult, it was recommended that people would also get it and so on. And that's where the tweak in programming comes. Our expanded program for immunization was very infant and child focused and so on. And now we are working with the county to say, how does COVID-19 vaccination get integrated into the country's expanded program for immunization?
When we're talking about integration, is basically putting it as part of routine vaccination, where people can access it not in a specific site, but if you go to an immunizing facility, you get it as part of routine vaccination.
From the triage desk, we have also registration desk. We have a trained HRIO. She has a system that assists her to validate a client if he or she has been vaccinated. There is a system called mchanjo. You log in and then you put the client's identity, and then you'll see if the client has been vaccinated or not. You'll see if the client has been given first vaccine or second, or the client need booster.
With those integration and the outreaches that are supported by Fahari, we have managed to reach so many people, and I think that one has helped us a lot to boost both the COVID-19 immunization in the sub-county and the other services.
With their support, we've really had to push our facilities and ensure that integration is done. So what we are doing currently is that as they bring their reports on monthly, if you don't have COVID vaccination numbers, that's when it starts to do discussion on why are you not integrating.
Provided access to COVID-19 vaccine at ward level through mobile vaccination centers. Enhanced infection prevention and control IPC measures through training and provision of IPC material. Enhanced community penetration via dialogue, meetings and health promoter engagements. FYJ-supported CCC have reached 61% coverage, up from 19% in October 2022. School-going children aged between 12 to 17 years were reached out to. Integration of COVID-19 vaccine into 92% of Nairobi's vaccinating facilities.
We have also embraced the integration agenda, which we started towards the end of last year with the USAID Fahari Jamii team. We have built capacity for about 158 sites, and so we are doing integration of the vaccine alongside other vaccines.
Provided access to the COVID-19 vaccine at ward level through mobile vaccination centers.
COVID-19 vaccination in Kajiado County has been targeting the elderly because these are people who are vulnerable, and the people with underlying comorbidities. By statistics, I can say that, for example, the people living with HIV, we've been able to vaccinate 75% of them out of a TX score of around 17,000.
The program had exemplary best practices showcasing effectiveness.
Kanairo tuko chonjo, pata chanjo uwe chonjo. Kanairo tuko chonjo, pata chanjo uwe chonjo.
The innovation of that song really touched or reached quite a number of people. It was the catch of the moment. And when you play music, it's not like when you are dictating on a TV. People would be making fun. What is this all about? They repeat it again and again, and they would grab the words, and you could even listen to children singing the song. But by singing the song, they are sending a message.
we came up with an idea of, since most of our clients were not seen during the day, most of them were going to work, and through that, we realized we could introduce something called moonlight, in that we are going over the night from 6 p.m. up to all the way to 9 p.m. So because of the dark weather, because it was dark, the Fahari Jamii, they also bought us lights, so that we were able to now go all through the night because we had good lighting.
The Maasai community, the most difficult population are the women. But the good thing is, whenever the men authorize them to accept the vaccines, they will normally take them without hesitancy. So in all our decisions, we normally involve our men and the focal persons in the community.
Kenyan communities unite, celebrating declining COVID-19 cases and rising vaccination rates. Optimistic and determined, they eagerly anticipate a post-pandemic era with recommendations aiming to boost vaccination rates. Strengthen integration of COVID-19 vaccine into EPI. Focus on priority populations such as PL-HIV and CDs. Defaulter tracing through screening of vaccination status in the community and in the facilities. Complete ownership of the COVID-19 program by the county and sub-county health management teams.
We appreciate that we've been having consistent supply of vaccines, but this particular one, the Pfizer, reaching the young ladies and young mothers has been a challenge, since it is specific for those who are pregnant and lactating mothers. They can get the Pfizer vaccine. The mother is willing to be vaccinated, but we don't have specific vaccine for those mothers.
We must slow down the rate at which people are getting it. We must slow down the rate at which, when people get it, they are affected by it, and we must be able to manage those who are affected to a greater degree with it.
I would recommend that we continue sensitizing communities at all levels, especially the highest level, at the governance level. I think we were not able to engage with them very well, and maybe even have small handbooks, produce small handbooks that leaders can refer to when they're in barazas, and be able to communicate health messages to our communities.
Agigira umuno. Dara doye moyandi abori alori abori dangara gigiru ndorge. Na go udire na kinor na leng. Be anda mogia giyo ngolo mboke. Radoye tokol. Ana be gidu lo be ngolo mboke no na gira lawa giyo. Na go gigira umuno ado. Giyo ga na namo radoye moyanda alrumana. My
recommendation, if they can continue and support us, especially with the outreaches, because even some schools, they are calling us to go, but you see now, we don't have the support. We don't have a vehicle to reach them there.
Ukipata mtu anakushika mkono wakati uko na hitaji, huyu ndio rafiki. So mimi nashukuru sana kwa ile kazi mnafanya.
We really appreciate because through their effort, we've been able to improve majority of our indicators and the mentioned subjects or programs.
I must thank profusely, give them a lot of gratitude, that is USAID Kenya East Africa, for funding this project and giving us an eye-opener. We were thinking as individuals we would do this, but we've learned many lessons.
The journey of COVID-19 in Kenya reflects resilience, solidarity, and unwavering progress. As the country continues its fight against the pandemic, one thing remains clear: a COVID-19 vaccinated society is the true Fahari Jamii.